Actually, we have Namita, who's on the group with us, just spoke a little while earlier.
Yeah.
In fact, I was talking to her yesterday. We were talking about how when you get to the hospital, particularly if you're going second time for some issue,
Yeah.
you're thinking, why is this happening to me? So naturally, the doubts in the mind will prevail.
Yeah.
But also, you're asking people, like, tell me what's happening. And if everybody says it's okay, you relax, you don't worry, doctors are there. That creates more of a fear.
Yeah.
Why are they not telling me anything?
Yeah.
So I'm glad, even in fact, Namita's put on the group here that people, they're in Vasavi Hospital twice a day, a psychiatrist or psychologist comes to see them. So I think that's a good practice.
Yeah.
But can you give us some tips now in isolation? How can we manage this? Because this is counterproductive otherwise.
I think the two elements to that question, one is about how to counsel people in isolation and so on. The first part of that question was, what are the benefits of counseling? And counseling is essentially communication between two people, where one is presenting an issue or a problem and the other person is listening and guiding those issues and problems, wherein either listening to the flow of worries and conversation or answering the questions and queries. And in the whole process, the person starts to feel better. They seem listened to, the questions are answered, the doubts are clarified, and the worries are allayed. And the whole process itself is very, very therapeutic, as you know that. In hospital setting, I think it's even more important for people to receive structured counseling from counselors, from psychiatrists, but also from all doctors. And I tell you one thing, most of the doctors and most of the healthcare professionals are already trained and qualified to give medical counseling and counseling of issues. Essentially, to say that when a person comes with a problem, a good doctor, a good counselor would answer those questions even before they're asked. So sometimes they come with 10 questions and they wouldn't have asked them. All the questions are already answered. They already feel better. Last time we touched upon that to say that if you come with a problem and you need to leave your problem there and go back with assurances and answers. If that happens, then that is a good counseling session. And in a hospital setting where people have significant serious illnesses or conditions like COVID, then they need to be counseled even more in detail about not what the problem is, but where it is heading, what is the treatment, what are the outcome, and so on. COVID has instilled such fear that when people have COVID, we only think about the ultimate outcome, which is death, people dying within a day or two, healthy people dying within a day or two, and so on. Those news circulate much faster than all the people who recover. And as I told last time, 90% are recovering. Only 1% go to ICU and have sudden decline and death, unfortunate death. In isolation, I think the nurses and doctors are heavily covered in PPE kit. It's very difficult sometimes to understand who's who. But when we go on the isolation wards or when we go on the medical wards for other conditions, we tell nursing staff to say to simply keep talking. When you talk, the patient will come out with questions and when the questions are answered, you feel better. So we need to keep doing more and more of that. In isolation, talk to the people who come to you, ask the questions, write the questions down if possible, and ask all those questions in a systematic way. You have the technology with you to assist you. You can ask those questions outside as well. Families can clarify questions for you and allay all the fears. There's no point suffering in fear. If you have doubt, you need to ask, because when you ask, you get the answers.
Yeah, I think, in fact, Namita put a nice note just now saying in hospitals, you're reminded of all the friends and family you have lost, whether you like it or not. So that is one thing. And can that, the projected fear, association, projection, however we look at it in psychological terms. Would you like to also tell us something about that, Doc, if you don't mind? Because I think this is a major issue now.
I think association, you need to disassociate when you have illness yourself. So for example, if I have COVID, then I need to disassociate from what I know, and I need to link up with, or put the context into my age, my background, my current health status, and my treatment that I'm receiving. And I need to get those answers from the doctor, because everybody is unique. Every person is unique. Every person's response to an infection, to a virus like this is very unique. We are still baffled by how the virus attacks very badly to some people who are very healthy and not at all to somebody who are very old. I've seen 80-year-old recover very easily and go back home and get infected again and recover again. So putting in context, putting in perspective about your illness and getting the right information about you, not about COVID in general, will hopefully calm you down, will hopefully ease off your tension, will hopefully help you sleep better, will hopefully improve your mental health. which is again, as Ian mentioned at the beginning, to say that is so crucial for recovery.